So hello everyone, welcome to Nursing Tutors YouTube channel where we share medical content, especially for medical students. So my name is Bruce Kamusime, BCN/PGDME is my profession. I'm a nursing tutor and a facilitator at Nurses Tutors YouTube channel. Today we are going to look at a very interesting topic, and we are going to look at general principles or general rules that you can do or that you should do before doing any nursing procedure. And we are going to look at one by them, and the moment you understand this nursing practical, it will be very easy. So if this is your first time to land on this page, subscribe and share to your colleagues for more videos. So we shall also be having practical sessions in YouTube Live. So subscribe. Let's start right away. So the first principle or the first rule that you're going to do the moment you meet the patient or you reach a practical station, number one, you're going to greet the patient. Greet the patient, and in greeting the patient is not a matter of saying good morning, how are you, what, but you must, this greeting is a part of creating a rapport with the patient. You're going to greet this patient with a smile. You're going to greet this patient with eye contact, with a body language that really makes you get connected to this patient. And that is maybe after greeting this patient, you're going to forge a short brief story with this patient to make sure that this patient gets away the fear and now is at par with the health worker and create that short-term relationship with the patient. So that is the first thing, greeting the patient with a smile, greeting the patient with eye contact, and greeting the patient with body language. The second principle, you're going to introduce the patient by name. So meaning you're going to talk about yourself. So introduce yourself by saying your name, maybe your profession, your credentials, a short introduction that is very relevant that you think the patient should know. And then you're going to briefly explain, introduce the role that you're going to do for this patient, and maybe thank them, maybe for coming to hospital. For example, on our slide there is an example of a brief introduction. So you're saying always introduce yourself to patients or clients and family members by name and credentials. For example, my name is Bruce Kamsime. I'm a nursing officer and I'll be in charge of your wound today. So they are saying do not remain nameless. Don't say I'm Sao. Don't say I'm a health worker. That's not enough. Generic entity and thereby minimize your role. So also summarize your role. Let the patient understand the role. For example, if you tell a patient that I'm an anesthesiologist, we really think they will understand. So maybe perhaps you have to explain what anesthesiologists do as far as their condition is concerned. Let's now go to the next point. Next point is that you're going to explain the procedure to the patient. What does explain the procedure to the patient mean? Meaning that you're going to define the purpose of the procedure. You're going to define the procedure itself. You're going to use a simple language to make this patient understand. For example, if you're going to do a subtotal hysterectomy or maybe transvaginal hysterectomy, this mother, do you think really this mother will understand? You have to explain to them in a language that they can understand. And then step by step details. If this procedure have maybe some steps, explain the patient what will they go through as far as you're working on them. Explain to them the risk and the benefit of this procedure, alternative options that are available. Maybe they may need to opt for other options, and name your role in this procedure. Then the other procedure is that you're going to screen for privacy. This is another rule, another principle. You're going to use physical barriers. For example, from the video there, you can see that they are using privacy screens to make sure that the patient is not seen. So you're going to create a physical barrier from this patient with this patient from other patients, separate them with curtains, privacy screens, maybe put them in a private room, private area, maybe close the windows, because this safety, the feeling of this of safety of these patients, it enhances comfort in these patients, and which is very, very important. And remember, one of the ethical principles of nursing or medical profession, privacy and confidentiality, are very, very important. Then next step is positioning the patient. You position the patient in a position that is applicable to the procedure you're going to do. For example, maybe if you're going to deliver a mother, you may need to put them in a lithotomy position, because the lithotomy position is the one that is maybe used for vaginal examination or delivery. If he maybe has a heart issue, you have to position them in a cardiac bed. If maybe they are having a respiratory issue, same sit-up position. Maybe consider how you can position a patient with a fracture, patient is difficult in breathing, how you can position the patient you're going to pass an EG tube. How about the one with shock? So positioning varies with a certain procedure that you are going to perform. Then after positioning this patient, you're going to wash hands systematically. You're going to wash hands so that you do not contaminate this patient, because perhaps maybe you have touched other things. So you're going to wet your hands with soap, then you rub palm to palm, then with fingers interlace, the what and what. But you have to follow uh, those steps that the World Health Organization established. Remember the 5 moments of hand hygiene. When do you have to wash hands? You remember before aseptic technique, before contact with the patient, before touching the surroundings, maybe before, after exposure to body fluids and what. So when they are visibly dirty, so those moments, put them in your hands, and then they will help you remember when you're supposed to wash hands. And then uh, the next step is that we are now going to do the procedure. So you're going to do the procedure that you had prepared for, or you're even going to start preparing. But in this procedure, as you're doing the procedure, I called upon you that you have to ensure that there is safety. Safety to the patient, safety to yourself. Make sure there is efficiency. Infection control is very paramount. So you have to make sure that you have gloves, put on PPE, and perform that procedure that you had wanted to perform. If it is bed making, start immediately with your assistant. If it is maybe waste segregation, start. Catheterization, nasogastric tube insertion, maybe oral care, providing a bedpan, immediately start the procedure, gloving and etc. So now the next step that we are going on, or the next principle, that you're going to explain the procedures, the findings. These patients may be what, as you've been doing a procedure, you found out, for example, you're doing a vaginal examination, or you may be doing a cancer screening, and the pap smear comes out positive. So you give these findings to the patient. Even giving, just doing oral care, and during oral care, you identify that the patient has oral thrush. So you're going to explain to the patient that she's having candidiasis. So you have to also look at that. So explain to them, assess the prior knowledge that they may be having, use a very simple language to make sure that they understand, and then use visual aids where possible. Then explain the effects of these conditions to their health, and then maybe verify the findings as laboratory and clinical correlations. Uh, the next step is that you're going to clear away. So you're going to clear away. Clearing away, it means you're going to leave the place the way you found it, or far better than you found it. You can see the nurse there is cleaning the bed, even with using alcohol. to make sure that it is completely free from microorganisms. So you're going to clear away by disposing the waste, by environmental cleaning, removing blood and soiled linens, uh, decontaminate equipment. You're going to remove PPE, for example, soiled gloves, soiled aprons. Then you're going to do safety check, make sure there are no sharps and needles left behind. And then you're going to segregate the waste. You're going to rewash the hands. You have to rewash these hands because you have been in gloves, or maybe they have been contaminated with blood. So now this time around, it is more on the safety of health worker to make sure that you are very, very safe. So rewash the hands, still following the whole procedures or steps, and then make sure that you remember the 5 moments of hand hygiene. So you're going to document the findings. You're going to document the patient's details. What time have you performed the procedure? What are your findings? Care plan. You write nurse's progress notes. Write subjective, objective data collected. How was the assessment? What is the management plan? Then what is the problem identified? What could be the possible interventions? And then evaluation. Then data collected, action and response. So you can collect all that data. So meanwhile, subscribe to Nursing Tutors channel for such wonderful presentations about practical. We also have other videos, so catch them up. But a summary of this video, we are looking at the general principles or general rules followed when performing nursing procedures. We said the main start is greeting a patient, you introduce yourself, screen for privacy, wash hands, do the procedure, explain the findings, clear away, and then you document the patient's details. One more time, subscribe to this YouTube channel. Catch you in the next video. You also watch other videos that are uploaded on our. Thank you so much. I wish you well.